You're going to get a little, yeah, so it's funny that way. The flag goes down. Well, hello, good morning. Welcome to Healthy You. I'm Kim Martin, host of your show, and do we have a show for you today? So listen, if you are struggling with any kind of joint pain or you know someone who's struggling with joint pain, please be sure to share this, encourage them, shoot them a text really quick, invite them to watch this show, or you can come back later and watch it if you don't have time to watch the whole show. It's always going to be posted, so you can watch it later and share it on your Facebook because this is going to be awesome. We're going to be talking about options other than surgery. Doesn't that sound great? Yes. So what we do is every Wednesday morning, we come at you live right here at Peoria Life to help you get educated and share information with you that will help living a healthy lifestyle a little bit easier. And we know that if you're in pain, that makes living a healthy lifestyle, I wouldn't say impossible, but it certainly puts a damper on things, doesn't it? So my guests today are my friends, Christy Durbin, Dr. Christy Durbin, hi.
Hi.
And Jill Briney, welcome Jill.
Thank you.
And these guys are from Synergy Healthcare and Sportsplex complex or facility. But you guys do a special therapy over there that we want to get the word out about.
Right.
And read you like I call it stem cell therapy. That's what we know it as. And it's fast becoming a better option of having that grueling surgery and recovery time.
Right. It's definitely, we had a lot of patients coming in that were in a lot of pain, joint pain. And before, we were able to do acupuncture or maybe some adjustments to try and keep them comfortable and trying to help them maintain their lifestyle. But they were going through the medical route where they would start with, anti-inflammatories, and then they would go to cortisone injections, and then they might go to like a rooster comb injection or hyaluronic acid to help put a little cushion in there. They've developed new injections that are called Synvisc or Orthovisc. That seems to be, they follow those that protocol pretty well. It's kind of a set cookie cutter model. If you fail cortisone, then you go to the next thing, and then it's the next thing, and then it's the next thing. But we were finding that patients were coming in, and even though they were going through these series of injections, they were still hurting.
Right.
The condition was actually getting worse because those types of injections don't help the condition. It just covers up the
puts
pain.
a Band-Aid over the pain for
and
a temporary fix.
You're right. And so those people were continuing to do their exercises or do their walks or their hiking or just their regular daily activities. And it was actually worsening the condition of the joint itself. So then they would get to the point where there's nothing else to do except for surgery. So usually before surgery, we were seeing those patients. They're like, what else can I do?
I don't want to have the surgery. I know.
I
I talk to the ladies all the time. And I know I have several of my Curves members that have had amazing success from this. So I'm just like a huge fan.
Yeah.
It's awesome. But I hear them every day saying, I don't want to have surgery.
Right. So
surgery
now
should be a last resort.
And it is. Yeah, absolutely. So now we have the opportunity. They've developed regenerative therapies. It's the first time there's been anything like this on the market where you can actually start to regrow the tissue. So it's not putting a temporary cushion in.
Right.
It's not giving you temporary pain relief. It's actually stimulating your body to start regrowing that tissue that's there. So you will see evidence of that new growth, like on an ultrasound. We do ultrasound to see what the condition is of the knee initially. And then after the injection, we do ultrasound like months later, and you'll see that new tissue that has grown.
That is so cool.
It's
I
so
love
awesome.
science. I get so excited about that. Is that amazing?
It is.
You must love working in
I
an
do.
environment like this where you
It's
see
so
people.
neat because this especially is not masking the symptoms like everything else was. This is actually getting to the root of the cause
Right.
and fixing that root of the cause, not just masking
So
the
let's
symptoms.
be clear. It regenerates cartilage.
Yes.
I mean, that's the bottom line.
Yeah,
Because
it does.
that's what people don't recognize. So this is what I hear. They go, oh, well, that might not work for me because I'm bone on bone.
I'm bone on bone.
Now
Yes,
explain
we hear
what
it all the
that-
time.
yeah. Now explain what most of the time bone on bone means.
So a lot of times in one area of the joint, you are bone on bone, but in another area of the joint, you still have some good spacing, some good cartilage.
Right.
And that is what the stem cells are going to latch onto and start to regrow and regenerate. So as long as there is still some good spacing, if you can move your joint, generally you're not all the way bone on bone.
That's what you taught me, because that's what we hear so much. And I think a lot of times doctors, they share your bone on bone, and they're telling you the right information.
Right,
They're not
yes.
trying to trick you or anything like that. They're giving you the information that they know best at that particular time. But the truth is that most of the time, there is a little bit of cartilage left.
Right.
And if there is some cartilage left,
There's hope.
There's hope. Yes. Because you can inject the stem cell and it turns in, it basically attaches to whatever it is that you...
Whatever's inflamed.
Okay.
So there's other factors that are in that fluid that's injected. So there's cytokines and they're and growth factors, and it's kind of like the cytokines are kind of like the foreman on the job.
Right.
So they tell those other cells what to do, and stem cells are able to become any type of cell. So, bone, ligament, cartilage, anything. Stem cells are like your cell it's your master cell. It differentiates into all other cells. So the cytokines and the growth factors kind of tell it what to become. So as long as there's inflammation there, those cytokines are drawn to that inflammation, and it stimulates then the production of that tissue.
Right. Now, you have a success story that's very close to your heart, right?
I have several that are close to my heart.
You have many, but your dad. I'm talking about your dad.
Yeah, we'll see.
Don't worry, all of her patients are her favorite. You don't have a favorite patient.
Right.
You're all equally loved.
Yes, no, that is true.
Right.
But yeah, my dad is special. He was told, he had went through all the injections, was told that he needed a knee replacement. He's a very active, young 69, so extremely on the go all the time, still working full time. I mean, he didn't want to slow down to have surgery, and honestly, surgery just scares me to death.
Right.
And so we started looking for something else for him to do. And that's when we came across the regenerative therapy. I really started researching it, figuring it out. He was starting to plan his life around his knee pain.
Yes.
So he knew
that all the
if
time.
he went and did this one day, he would be on ice the next day and wouldn't be able to do his activity that he wanted to do the next day. So he would take it easy. He would start to ice every hour. He would come in from doing activity and sit down. I mean, really, he wasn't even living his life anymore.
Right.
He was living it around the knee pain.
Well, pain in general just kind of paralyzes you.
It does.
I mean, because even if you just get, I think about if I get a little headache.
It's like,
it just shuts you down, and I can't imagine
in his knee
having
pain,
that kind of
it was
physical
constant.
pain constant.
Yeah,
yes.
it was just constant, but it would ramp up if he did certain things.
Right.
And so it's been a year. He had the injection last year, baseball season. Had the procedure done in our office. We went to a ball game right after. People are always like, "Oh, do I have limitations
Right.
after?" What?
This is the beauty.
It took about an hour.
That grueling time
Right.
period where you just had your knee cut open or your
Right.
hip cut open.
Right. And, he came in. We were there for about an hour. He had the procedure done. We went and watched my son play baseball after. He had a 3-hour drive home the next day. And I kept calling him, like, "Hey, Dad, how you doing?"
Right.
And he's like, "Well, I'm still feeling good." Like, I don't know.
He didn't trust you.
Yeah, I don't know when it's going to come back, but for right now, I'm still feeling good.
Right.
And so, then my phone calls started to space out a little bit more. And then I was calling him, every couple weeks, like, "How you doing?" He's like, "I'm still not in any pain," just waiting for it to come back.
Right.
And it's been a year, and a few months and still pain-free.
And so now you guys can do the x-rays and you can show him the Doppler.
We have, yeah. We did, we re-x-rayed him, showed him the new growth, redid the ultrasound, all that bright white new tissue,
You can see
so
it.
then,
oh my
you
God,
can see
I
it.
just got chills.
And so then his question, because he's on the go all the time, he's like, it's been worth it to have it already. He totally feels like it gave him his life back.
Right.
But he says now, well, I have to have this done again.
Ah, yeah.
How long's it going to last?
Go back and get it done
because you're
again.
used to that, right?
Yeah.
So I said, Dad, you have a new knee, basically. Your knee is going to outlive you at this point. You're not having it done again. You're good.
New knee, because all that cartilage and tissue is new.
Yeah. Regenerated, rebuilt.
Yeah. And so the funny thing is, his other knee used to hurt. But I think it was because he was compensating so much. And now that knee feels good too.
Right. Well, that happens. I know this from exercise kinesiology, right?
Yeah.
So through all of my certifications in that, I mean, it's like the, hip bones connected to the leg, but
Yes.
So then if you start compensating those tendons, your IT band, that probably was his IT band, which I'm preaching to the choir, this, but that that tendonitis probably is what he had.
Yeah, you have all different problems that stem from one joint, and then you end up, if you can rebuild that one joint, a lot of other problems go away.
Yeah. And so, hey, you may have some questions right now. You may be curious as to how do you know for sure if this would work for you? So I want to encourage you to show us some love. You can comment and ask your questions. I promise you, we'll put this monkey on Jill's back.
Yeah.
Jill will come back and make sure you answer those questions, right?
Definitely.
And they can also reach you, though. What's the best if someone's thinking, well, I want more information, because I know you guys do free consultations.
We do.
Which is amazing.
And that's usually the best way. If someone's questioning whether it's the right thing for them or not, they can come into our office. It's no charge. They can sit down. We have a conversation about what's going on with them. And then we can say, it's a good thing for you to do, or no, maybe it's not the best thing for you to do.
That's amazing. So basically you have nothing to lose.
That's right.
And everything to gain. You know what I just posted on my social media? I said, if you have nothing to lose and everything to gain, you do it.
Right.
I mean,
right.
you do it. I mean, it's a no-brainer, right?
Yeah. Right.
It's amazing. And so now I know we really spend a lot of time talking about this regenerative therapy and the stem cell, and because it's just amazing. It's life-changing.
And it's new. It's new. But they've been doing it in other countries for years.
Isn't that funny?
But over here, we haven't been. So for us, it's a new
So
thing.
in the United States, it's new, but they've been doing this therapy in Germany and all over forever. So let's talk a little bit about that statistic, because all right, so first of all, I read this morning, the Philadelphia Post published that over 1 million joint surgeries are performed every year. 1 million. 1 million people.
That's crazy.
A year. Mm-hmm. That is crazy. So this is revelational. I mean, this is going to change that drastically. And I also know that even in the orthopedics and doctors are starting to do this therapy as well.
Right. Well, this is a statistic that surprised me the most. And this is what really opened our eyes and made us be like, we've got to get out and tell people about this. With a knee surgery, a total knee replacement, 1 in 400 die.
Oh my gosh.
Following. And it could be complications of the surgery. It could be blood clot. It could be infection. Lots of different reasons. But the statistic in the Journal of Orthopedic Medicine came out, and it said 1 in 400 die
in the 30 days following.
1 in 400.
Within 30 days following.
So it's not just they die. With all the ladies at Curves. And I said to them, I'm like, if you were walking by a roller coaster.
Yes. And we have used this canvas.
We stole it. And I said, and there was a sign that says 1 in 400 people die on this roller coaster. Would you get on it?
Right.
Heck no. But when you just don't think about that. And again, we don't want to make anyone feel bad, because there are times when someone has to have the surgery.
There are times, yes.
There are times.
And then thank goodness they can.
And thank the Lord we have amazing doctors, and we have the technology to have those surgeries when they absolutely have to. But if there's an option for those people
that
You got to find out.
Yeah, if you don't
We
have
want
to
to
have
provide
it.
an alternative,
Yeah.
you know, so that for those people that really do not want to do surgery at all, which no one's going to like volunteer to do surgery. Yeah.
If you watch it on
But-
YouTube, you tell me if you're signing
Well,
up.
But it's
the
an,
thing is
but sometimes
people
there's
can
no
be
other
in so
option.
much pain
Sure.
that they
Yeah.
run and I mean,
Yeah.
I have to say,
Or they don't
if
know
I
that
did-
there's another option to have.
And sometimes people don't qualify for the allograft
Sure.
tissue. I mean,
Right.
sometimes people come in and they say, am I a candidate? And sometimes they have extenuating circumstances. They're not a candidate.
They can't
And we're
be.
sorry. You know,
And it-
we,
right.
we wouldn't feel right doing the injection and the procedure because it's not going to work for you, you know, and we just are
Right.
honest and we tell them that. And so they are going to be the person that, you know, has a knee replacement, goes through therapy and gets better, you know, doing that. But if we can prevent that, we want
it's
to.
pretty far between. It's pretty few and far between that someone's not a candidate.
Right. It has to be a pretty extreme situation, I'm sure.
Or like Dr. Christy said, there's some other things that might be going on
Okay.
that maybe need to be taken care of first.
So
or,
sometimes maybe they need to take care of a few other things, and they still then they may be
Maybe.
able to
Maybe
become
they
a
could be.
candidate.
Mhm. Yes.
Right.
But what I see and what I was going to say is a lot of times when someone is in that kind of pain, they just do want to have the surgery, and I can understand that. I'm like, I don't like pain, and so
Right.
if I were in pain, I'd be like, okay, let's go ahead and do the
Let's do it,
surgery.
yeah.
If this was what I
Yeah.
thought my option was, because I want to get out of pain as quickly as possible.
Right.
But this is what we want you guys to remember: is if you come for a free consultation, you can see if you have another option.
Right.
and as
love it.
and yeah. And if you're wanting to get out of that pain quickly as possible, this is the way to go, because surgery you're going to have pain and therapy afterwards,
Right.
but with this it's almost instant. Within a week you're going to it's amazing.
Within 48 hours, your body starts to clear out that old inflammation. So that
So
alone
you're already
feels
feeling
better.
better.
Isn't
Yeah.
it amazing what
increases-
your body does?
Yeah,
Yeah.
it increases the blood supply to that joint. So already you're starting to get nutrients in there that you haven't had before, and you're already starting to feel better. My dad said that he started after 48 hours, just, you know, mildly started to feel better and then feel better and then feel better
Yeah.
and then feel better. Like
After
it was just
4
a
weeks-
Now,
gradual.
a year and a half later,
He's
Yeah.
pain-free.
he's pain-free,
Yeah.
no surgery.
Yeah.
Yeah.
And he's the new man. You know,
Of
it's just
course.
unbelievable.
You can see when someone's pain is gone.
But-
Like, it just,
I have to tell you, my husband had it 3 months ago, and I didn't even realize he was in that much pain. Like, he never really. I just thought, I just kind of thought he was getting a little lazy. Like, hey, honey, that thing's downstairs. Can you run down and get it? Well, can you run down and get it? Like he was starting to avoid the stairs. I noticed he wasn't playing outside with our son as much, like basketball and stuff. And he said, I think I'm going to have the procedure done on my knees. And I was like, oh, okay. He's not that old.
Right.
He doesn't have that much degeneration. But the degeneration that he did have from all the sports and stuff was starting to affect his life. And he
Yeah.
recognized it and was like, I don't want to wait until I'm barely moving to have it done. So
Right.
he went ahead and had it done like 3 months ago. He's a new man.
I-
He is up running around. He goes to Menards every night. I mean, it's like crazy.
My husband down there too. My husband is like your husband. Like, he will never complain. If he complains,
It's serious.
It's like 911. Something's really wrong. But I've been noticing, and he ran with me. He ran a marathon with me, and after that, he was like, "I'm never running again," because his knee. He played college football,
Right.
and so his knee was killing him. And so he still exercises. But I notice in the morning when he comes down the stairs, he's kind of straight-legged.
Yes.
I'm like, and he has said, I know I have, knee issues just from all the impact
Right.
from football and
Right.
things.
Anytime you have an injury to a joint,
Right.
it really starts that process of degeneration. And so
Yes.
why, it's like, why
I need
wait?
to send
Why,
him- he's got to come over and do
And the
that
energy.
consultation so you can see what's going on there and see what he
Oh,
needs
yeah.
to do.
Well, and Sean's energy level is through the roof now. And I think it was before he was constantly fighting that pain off. Like it's tiring to be in
it's
pain all the time.
exhausting. Like,
Yeah.
it's exhausting, and it is. You're absolutely right. I just love that, what you guys are doing. Now, granted, you have an entire facility.
Right.
So I hope we have lots more shows to share all the things that you do every month and the different topics and stuff. But this is one thing that's just making waves, so we're making a big deal out of it.
Well, this is our most exciting thing.
Yeah, because you are a chiropractic office, but one of the beauties of what you do is you have physician assistants and
Right. So we're medical and chiropractic all under one roof.
okay. So who actually performs the procedure for the therapy?
We have a physician's assistant that performs the procedure, and it's just a simple injection.
Okay. So you have a physician assistant on staff.
Yes.
So it's awesome. So you have the medical side of it and then the chiropractic and kind of that holistic point of view. But you guys, just to share really quick, you do acupuncture.
Right.
And so
Yeah, we do acupuncture, chiropractic, weight loss. We even do sports physicals and school physicals for kids. You know, a lot of parents don't want to take their kid in somewhere where they're going to get germy and sick. And so really at our office, we have mostly healthy people. And so it's nice to be able to run in quick. Even if you had a sore throat or something that needed to be checked out, our medical staff can handle that.
wow.
Yeah.
That's awesome. How do they reach you? Like, what's your number? What's your email? What's all that good stuff?
Yeah, great. So they can call us at 309-688-4484. Our website is www.synergyphysicalmedicine.com. And we have Facebook pages, Synergy Physical Medicine and Synergy Sports Facility.
Yeah, so you can find them easily.
Yeah.
Or if you just go to I'veDecided.org, you guys are a part of I've Decided,
right.
and you're listed on resources on
Yeah.
there. So easy to find.
Yes.
Get yourself scheduled because it's a free consultation. Don't be in pain.
And we are right off that interstate too. So our new location, we used to be in Peoria. We moved to East Peoria not that long ago.
Right.
And our new location is just, it's
It's
minutes
literally
from the
right off, is
interstate.
it
Yeah.
Pinecrest?
Pinecrest
Right?
Drive.
Literally
yeah.
right off Pinecrest in the Peoria area off 74. And it's a beautiful facility.
Oh, thank you.
It's beautiful.
We love it.
Yeah, it's so pretty. So it's a nice place to visit too. Great care, great place to visit. It's pretty when you walk in. So that's always nice, you know. All right. So statistically then, what do you think when just looking at the numbers? What I know they're asking, what are the odds that it's going to be successful? You shared your dad's testimony. You shared your husband's testimony who just had it 3 months ago. What happens if have you ever had where someone didn't get good response so far?
No. Everyone sees results.
Everyone so far that you've treated sees results.
Yeah, because you're injecting that allograft tissue into the joint. It latches onto that good tissue that's already there, and it starts to regrow it. I mean, there's just no reason that it wouldn't be stimulated to grow that new tissue. So on every single case, you can ultrasound and see that new tissue growth.
Wow.
There hasn't been anyone that hasn't had new tissue grown.
What about any side effects?
Oh, there's none. So you don't have to worry about any adverse reactions, your body rejecting it. There's nothing like that.
So you don't have. No one has to be fearful of any adverse reaction.
No reaction.
I think you gave me the statistics.
We did.
Yeah.
There was like 500. They're
Over
500,000.
Right.
When we first started doing it, there had been 500,000 injections using the same procedure that we use in our office, and there had been no side effects to that.
Zero.
None. Right.
Zero, none.
Yeah,
so
zero,
now,
none.
0, none.
Absolutely
so
none.
let's think about this. Now if you're walking by the roller coaster
Right.
and there's a sign that says, you have absolutely no chance of being killed on this roller coaster. So enjoy and have fun.
Yes,
Jump on the ride.
right.
Jump
Jump
on
on.
the ride. That's
Yes.
way different than 1 in 400 people die on this roller coaster.
Right.
It's really kind of a similar
Scary.
analogy. And it is scary. And I know that it's scary. So
But I think it's just that's always been the option. So
Well,
people don't even
right.
think about it. I
Right.
mean, it's always been the cortisone, then you do this, then you do that, then you have the rooster comb injection, then you have Synvisc, and then if that doesn't work, well,
now let's
Now we're
back
at
up
the-
because cortisone is a synthetic
yeah.
drug.
Yeah.
And so side effects.
Yeah.
Everything to this point has
and
a
actually
side
it
effect.
causes more breakdown of the joint. then
It does. I don't even want to start.
Yeah.
That's a whole nother show.
Yes,
in
that's a
itself.
whole other conversation.
That's a whole nother show.
it's
But I
always-
know I had a family member that you can only take so much
Right.
cortisone shots because it's damaging to your kidneys,
everything.
and
Yeah.
everything. Yeah.
But that's always just been standard procedure, So when people say, "Oh, I'm having a knee replacement," it's so common to, everyone
Right.
it's so common.
Right.
It's
Because
normal.
we can do it.
Right. And so now we're like, "Oh, wait, you don't have to do that."
Yeah.
And you have nothing to lose. You come in for a free consultation. It costs you nothing but a little bit of time. You get to meet Dr. Christy and
You have a good time.
And Jill, I mean, what can that hurt, right? I mean, it's just, I feel like it's just a great thing to do and find out if this is an option for you. And, there's no obligation. If
No.
if you, for some reason, decide it's not a good fit, then they're not going to,
I think it's
going to
always
handcuff them to the chair.
No, but I always think that people should make a decision based on knowledge, not on fear, not on pain, not on anything else, but based on knowledge. So here's the knowledge. We want to give them that knowledge so that they can make an informed decision.
And if you are going to have surgery, wouldn't you want a second opinion anyway?
Sure.
I mean, generally
Personally,
speaking,
I would, yeah.
if you're going to have some type of a major, any procedure done, I would like to get a couple of different points of view.
Yeah, I'd like
You
to
know,
weigh my options.
See
for
what
sure.
all the options are. And now we live in a culture of awareness. So people are understanding the more holistic view. And that is starting to become, I think, do you find that people are starting to look at that maybe first now? They're going, wait, is there something I can do holistically?
I do find that when people come in for a consultation, they typically have already done all the research. Like they already know what's going on with their bodies. They know the situation. They know the
Right.
statistics. They know the information. They've researched it. It's beautiful.
Isn't it amazing?
Yeah, the internet.
Yeah, it's beautiful. I mean, I don't have to tell them.
Yeah.
I want on Google.
I don't have to tell them anything. They know all about it already.
Sometimes
Yeah.
it's a double-edged
Yes.
sword
Right.
because sometimes there's a little misinformation, but
Yeah.
you can set that a little bit straight, but they
Right.
have the gist of it. That
Yeah.
is the beauty of the technology day that we live in.
And it's wonderful.
We live in an information day where you can find out anything you want to know. Sometimes it might not be 100% true, so you got to
Right.
really get your ducks in a row, but you can. And that's great. They come in and they already kind of know. So then they're really just looking to make sure
That they're a candidate.
that they're a
That's-
candidate and that they can relate to you and make sure that they
sure.
think you're the right doctor for
Yeah,
them.
we want everyone to be super comfortable in our
Right.
office. We want them to, love being around
Yes.
us and in our facility. So
Yes. And Jill, you're a patient educator.
Yeah.
So you go out in the community and educate for Dr. Christy and let people
and
know.
she follows up and she calls people. So
She's
if they have
great.
any concerns or questions, she, gets with them and spends all the time needed. She makes sure that all their questions are
Well,
answered.
your staff represents.
They do a wonderful
you.
job.
Yeah,
Yeah.
well, success starts at the top. So it represents the whole community that you guys have out there. Now, are you the only chiropractor that's out there? Do you have other chiropractors?
I have an associate that works with me as well,
Okay.
Dr. Brandy. Mhm.
Dr. Brandy, so a couple chiropractors.
Yep.
What else? Do you guys, you have the physician assistant.
Right.
Do you do massage therapy or anything like that yet?
We
or-
don't, but in our sports complex, we do sports training for kids.
Okay.
And so that's kind of a new avenue that we're taking on. We have a bunch of sports trainers that have come in. They do
Yes.
team training, they do individual training. They help people meet individual goals, or they train athletes to meet their individual
That's
goals.
awesome. That's another show too. My daughter
That's
plays
super fun.
volleyball. She'll be out there training for volleyball starting in December. So you guys
Nice.
have a whole sports complex out there that we would love to share. So
Yeah.
awesome. All right, listen. Be sure to post your comments, share the love, ask the questions. Jill will come back and answer those. Thanks, guys, for joining me.
Thank you.
That's
Thank
a half
you.
hour. Can you believe
went
it?
fast.
See, it goes really fast. It does. Easy peasy. So that was great. That's good information.